Good morning, everyone. Thanks for joining us. I have Michael Wittstadt here from mediGrüen in Darmstadt, Germany. My name is Christina Bauer, and I'm the Executive Director with Texas Lyme Alliance. I have been treating Lyme disease for 9 years and was a patient at mediGrüen 4 years ago. I received natural medicine as well as umbilical stem cells and my own blood stem cells, and received a lot of benefit from them. And we're going to go through today how you out there can receive some benefit from Michael's fabulous treatments there. There's been a lot of updates in his regimen over the last 4 years, so I'm excited to hear today what he's got going on over there. So Michael, can you tell us a little bit about your slides that you've created here today, starting with the first one?
Yes, sure. Yeah, this is the topic of today's little speech I have. It's about the herbs we use to treat Lyme disease. Our treatment is not only the fight against Lyme, it's also rebuilding the immune system. And this is also the most important part, but as a preparation for the stem cell process and the other treatments, we use herbs mainly to address the Lyme disease in the body and to reduce the bacterial burden and also the viral co-infections. And today it's about the herbs that we use directly against Lyme.
That's great. Mm-hmm. Okay, so the benefits and synergies of herbal medicine.
Today is the herbs against Lyme. In another part, I want to introduce the herbs we use against the co-infections, and in another part, then the minerals, amino acids, and orthomolecular medicine and functional medicine that we also use against Lyme. Before we then would have another presentation about immune system restoration and all this.
Wonderful. Okay, well, I'd like to introduce Michael with a little bit of information he's put together on his presentation here about who they are. mediGrüen in Augsburg, Germany is a naturopathic clinic in the heart of Germany, 30 minutes away from the Frankfurt airport. So it's very convenient in the remote territory of Odenwald. After working for the International Clinic in Frankfurt since 2012, developing a stem cell-based approach for the treatment of Lyme and trying to improve this program over the years, Michael started his own practice in 2016. During this time, the programs ran through numerous changes, always with the idea to make the program better and more successful. Michael treated hundreds of Lyme patients and is a number of celebrities from the Lyme community as well. So overall, how many years of experience do you have using stem cells to treat Lyme disease, Michael?
With the stem cells, it's now a little more than 10 years. Yeah.
Yeah, and it's a beautiful location here. So here is some contact information for Michael and a beautiful picture. That's where you get to do your treatments every day. And I had made a group from my experience, if anyone would like to join that group. I took a lot of really wonderful pictures from up top there of that building overlooking some of the views that you get to look at. And that is on Facebook at Christina and Michelle's Stem Cells. So here is his contact information that I will also put in the description of this video interview. So here is some of the pictures from his clinic for autologous stem cell therapy. He does bone marrow, blood, fat, and secretum exosomes.
The autologous exosomes and secretomes. So it's not from umbilical cords of other people, it's from yourself.
That's wonderful. And why would that be important before we continue?
I think it's important because when you use allogenic stem cells, you always have usually a gentle, but you have an immune reaction and your body tries to eliminate everything that's alien from your body. So you tolerate your own stem cells and your own material much, much better. It's not so important in exosomes because when you are have a really good cleaning process, there shouldn't be any problems, but you can avoid that by using your own material from your own body for sure.
Okay, and can you tell us real fast, what is an exosome?
An exosome is it's a little molecule that is a signaling device of every cell in the body. Your cells are communicating with each other, and these little exosomes or secretome tells other cells in the surrounding to do specific tasks. And in this case, it's to rebuild, to start growing new tissue, to start organs, to repair tissue. Yeah. Where are we?
Can you see it okay?
Yeah, I can see it. Yeah, our approach is basically that we try to lower the burden of bacteria and viruses in the body, so that we give the body time to adjust after the stem cell treatments. We want to fix the immune system at the same time. That's what all this treatment is about, so that your body is able to regain the power to control the body again, so that your immune system is controlling all the infections in the body, and that's what we consider health, because we would never claim that we can completely eradicate any bacteria or viruses, and we also think it's not necessary. It's just bringing back the body in a position where it can control all these infections. That's our goal. And to do that, we also have to detox, and detox is a big part of the treatment. Detoxing is so important because not everybody suffers from Lyme, but we see that a lot of people that have a heavy toxin burden before they develop heavy Lyme symptoms, they have this toxic burden, and we have to get rid of some of that, so that your body has the ability, the power to get on top of the infections again. And then the unique ability of stem cells is to repair in the body. I think that's what no pharmaceutical, no other supplement can do. They repair damage that was done before. And I think one of the most important things that is often overlooked is that we accompany our patients for over a year. And maybe you can also tell people that we stay in contact with our patients over a long time, and make sure that they can come to us every time, and we still have people after 4, 5, 6 years.
Yeah, absolutely. I, like I said, was a patient of Michael's 4 years ago, and I still send him questions every once in a while, and he's so kind to respond and offer any kind of assistance. He has sent me supplements and things like that in the mail that I've been able to purchase through him and not get anywhere else. So it's always a customized treatment with Michael, and the assistance doesn't stop after that first year. And that's also, I think, why you're so successful there, Michael, is because as a patient, I want to come back because of those things. So repeat business is always, yeah, absolutely. The very best referral is the word of mouth, and your success lends to the fact that your kind heart is the first thing that people acknowledge about your facility there. But the fact that you continue to help me and answer questions even about my congenital Lyme kiddos has been really a wonderful attribute to the service that you provide there. So let's get into the part 1, killing bacteria and viruses.
Yeah, usually we get confronted with Borrelia, Bartonella, Babesia, Epstein-Barr, Mycoplasma, cytomegalovirus, and all the chlamydia, and also Mycoplasma strains. So these are the most common co-infections we are confronted with. Borrelia, of course, is the main bacteria. That's, for us, it's a door opener for all the co-infections. So it's weakening your immune system, and then all the other bacteria and viruses can also cause their havoc in the body. We usually use a combination of herbs, so it's rarely only one herb. It's most of the times is 2 or 3. Sometimes we have to use 4 herbs in conjunction with each other. And the main herb we are using is our infamous Artemisia annua extract with DMSO. Infamous because it's
terrible tasting.
Yeah. And you also smell a little bit when you drink it for a couple of days after you stopped it also. So this is, but it's very, very effective. It's much more effective than only Artemisia annua. Then we are using in other patients in a combination with allicin, which is the main ingredients of garlic. Then you most probably will get a Dipsacus tincture in the morning. I think the English expression is Teasel, I just learned. Then Japanese knotweed, cryptolepis, cat's claw, and a special mix of horseradish with tropeolum when it's more the bladder issue is the urogenital tract in your body. So then start with the Artemisia annua. It's also called sweet wormwood. As I said, it's for me, it's the most effective herbal tincture we use, and I would also say it's more effective than most of the antibiotics, if not all of them, in that combination with the DMSO.
And the DMSO, I'm sorry, I didn't mean to interrupt. The DMSO helps the artemisinin get into the cells.
DMSO is a very unique substance. It can penetrate hydrophile and lipophile material. So it can penetrate every cell in your body. It can get inside, and it drags everything with it that comes at the same time. And that's an effect we try to use as much as possible.
And so then it means that it gets past the blood-brain barrier.
Yeah, it gets past the blood-brain barrier. It gets into muscles, into connective tissue much more easily than without. And yeah, it's going everywhere in the body, everywhere where Lyme is hiding also. In my opinion, it's also going into joints and helping there. Yeah, it's very powerful.
It is very powerful. Is this the green drink that Michelle and I did?
Yeah, that's the green drink.
Yeah. So everyone out there, it's terrible tasting. And we did a video on our Christine and Michelle Stem Cells Facebook forum group of her and I having a really good laugh over chasing the Artemisia with chocolate cookies. It's so funny. It really is terrible tasting, but it is very effective. So whoopsie. Okay.
Yeah. And we give a lot of other substances at the same time. So you will get the green drink in the morning now, and you will get a glass of tinctures. So we mix them in a glass of water, and you start drinking them both at the same time, so that they also have the effect of the DMSO. We are also working on new tinctures that we get with the DMSO with a German pharmacy. The next on our list is the cryptolepis. We will see when this will be available, but that's the next big step in my opinion.
Oh, wonderful. Okay.
Yeah.
Do you have anything on this next slide to mention, or did we cover all of it from the last slide?
No, I think I covered everything. You have the garlic smell from your skin for as long as you take it. What's important is that you have to counteract oxidative stress in the body, because that's the killing mechanism of the Artemisia annua. It produces a lot of oxidative stress inside cells, and that's hurting these cells. And then to protect your body against this oxidative stress, you need strong antioxidants like vitamin C, resveratrol, and vitamin E, vitamin A. All these antioxidants you can take. That's important, and that's what we do on a daily basis here. But you should also do that at home when you choose Artemisia for Lyme treatment.
Okay, and Do you have in here how long people typically stay, or should we mention that?
In the practice within our program, it's 2 weeks. For some patients, it's 3 weeks, but not longer. Yeah, we had, I think, 2 or 3 patients where we prescribed it after the treatment here as well. But that's, yeah, does not happen very often.
Okay.
Mm-hmm.
Okay, in this next slide here on Allium sativum, or garlic.
Yeah, that's garlic. We use the Angutzin or Alimed. That's the main ingredient of garlic. Garlic has the disadvantage that it's not going everywhere in the body, so it's very limited to the digestion system, and it also goes to the blood, but not to many more places. Therefore, we use it all together with the Artemisia and the DMSO, of course. So we hope that it gets there in other places as well.
Okay.
Sorry, drink.
No, you're fine. So the garlic, as some people may know, is a natural antibiotic. So
Yeah.
down below here at the last paragraph, it's a potent bacteria killer, but it also kills gut bacteria and may cause heartburn. It's a blood thinner. So he takes special precaution and an extensive history of medications that patients might be on before you come. So this is maybe a way to prepare to go see Michael, is putting these things together before you get there.
Yeah, it's also a sulfurous drug, but DMSO is also a sulfurous drug. So we it does not exclude it from your treatment when you are sulfur. That there are some genetic constellations where sulfur is not so well metabolized.
Processed,
so then you can then you can get problems with sulfurous drugs, with glutathione as well, MSM and all these. But usually you know that, and that does not exclude it, but you have to be more cautious at the beginning. Your body gets used to it.
Okay, yeah, that's important. I have
the same for garlic.
Yeah. Some people make that genetic disposition that Michael would plan ahead for things like that to take into consideration for your treatment. Okay, so this next one, Teso.
Teso, yeah, that's a pretty German thing. I think it's not so known in the United States. It was discovered by a German herbalist. We use it because it's more flushing out the Borrelia out of the connective tissue. It's luring it into the blood and out of its hiding places. So it's easier for the other herbs to get a hold of it. We also mix it together in the morning in our the glass with the other tinctures, and you also take it then with the DMSO over the day. It's a very gentle drug, so we never had any bad reaction from it. We also take it when you have when your skin is affected by Lyme. Some people have a pretty bad acne that could be caused by Lyme, and then that's also when we use the Teso in our treatment here.
Yeah.
Okay, then the next drug or the next herb we use is the Japanese knotweed. That's a pretty famous drug, I think. We have quite a couple of the Buhner herbs in our program as well. Not all of them, but I definitely like Stephen Buhner's approach. Japanese knotweed is very often part of our program here. So I would say it's a long time ago we left it out of the regime. Mainly because it can cross the blood-brain barrier, and we have by itself, and we have a lot of patients with neurological symptoms. We do not see that many patients where the joints are heavily affected, more these brain fog, depersonalization, heavy neurological patients. It also can regulate down the Herxheimer reactions in the body by regulating the cytokine response, which is also a big part of the treatment to handle all the side effects of killing and Herxheimer's. Therefore, we love it very much. And it has also an effect on the heart. So because a lot of Lyme patients have also heart issues, we see a lot of POTS and former Lyme carditis patients. Therefore, we use it.
Yes, and it's the postural orthostatic tachycardia syndrome that
exactly
can cause heart racing, dizziness, feeling like faint, things like that. And some people actually do faint, but that's an important part to try and sort off the negative side effects from this type of treatment, where the cytokine response is more inflammation. So we don't want to cause ourselves more trouble. So this kind of treatment with Japanese knotweed will help with the discomfort of the side effects.
Yeah, exactly. Handling the side effects of all the killing treatments is a big part of the treatment here. Yeah.
Okay, very good. So, yeah, great.
The next one, Cryptolepis sanguinolenta, which is also a pretty famous drug, also introduced, I think, from Stephen Buhner.
Okay.
It was traditionally used in the treatment of malaria in Africa, I think. It's very strong against the co-infections mainly. Therefore, we have it in the mix pretty often. It's more affected to has more affinity to the blood. So it's not going everywhere, but there we hope that the DMSO is helping out. But it's one of the most important drugs against the co-infections.
I see here that you mentioned treating Borrelia in the blood using this herb and in the digestive system. Can you focus for a moment on the trouble that Lyme disease can cause in the digestive?
What we see most often is that Borrelia or Lyme patients have a very slow digestion system. It can even go to paralyzes the digestion system. So we see that it's either very slow or at sometimes not functioning at all. So that's the main thing we see. I also think that over chronic inflammation there and not being able to process serotonin in the gut, when Lyme is very much in the gut, you have anxiety issues as well. So this is not only coming from the brain, that's also connected to the digestion system and Lyme there.
And you said serotonin, correct?
Yeah, serotonin.
Yeah. So this might assist patients who have formerly been diagnosed with things like Crohn's disease or irritable bowel disease.
Yeah.
Is that correct?
Yeah, that can also be symptoms of Lyme, in my opinion. Also, colitis, ulcerosa as well.
I'm sorry, I didn't mean to interrupt. Say that again.
Chronic colitis, in German, we call it colitis ulcerosa. That can also be. Yeah.
Okay. Yeah. I was diagnosed with Crohn's disease 30 something years ago. And a lot of times patients like that diagnosis will receive steroids and heavy medications like mesalamines. Once I got diagnosed with Lyme and co-infections and treated Candida, etc., which Candida alone can overgrow in a stomach that's not properly full of the healthy microbiome.
Yeah.
And then you can start to see a diminishment of the immune system because the gut-brain connection is so powerful. Yeah. I think these things are really important to address. So I don't believe I did this one. So this would be something I'd be interested in if I come back at some point.
Yeah,
Okay.
sure. We introduced a lot of additional herbs since you were here 4 years ago.
Okay, here you go on cat claw. This is a wonderful herb I've used.
Yeah, cat claw. I think we are one of a few places in the Lyme world where you can get cat's claw as an IV. I have to admit it's a tougher infusion. I had it myself, and the side effect in a lot of patients is that you feel like you have blood pressure 230 over 120. You feel that way, but I had it too. But we measured my blood pressure and it was completely normal. And this is also gone half an hour after the treatment. But this is possible. But it's very powerful also against Lyme directly. We do not use it alone, but it's very good when you have the affection on the joints. So joint pain, inflamed joints, and all this. When you have muscle pain and connective tissue pain, all this. It's you can also use it for the neurological symptoms, but there it works best when you take it together with the Artemisia and the Japanese knotweed. Yeah,
that's great.
Mm-hmm.
Okay, and some of the side effects he mentions here can be headaches. He mentioned blood pressure feeling.
Yeah, the headache is connected to that. So you get a red head and you think, wow, all my blood is going to my head. So it's not very painful, but for some patients it can be bothersome. Yeah.
And I noticed here in the very bottom sentence here, it says the plant is also used against high blood pressure, but you feel you have high blood pressure. That's funny.
You feel that way, but you don't have it. So it's weird. I do not know where that what is causing this feeling. So you feel like you have a really high blood pressure, but mine was completely normal.
And it's used to treat high blood pressure, ironically.
Yeah. As a supplement, you take it. You can take it against high blood pressure. Okay,
here is something.
Yeah, that's one of my favorite things. That's from a German company. It's called Angutzin, and it's a mix of the horseradish and the tropeolum. And this we use mainly in patients who have problems with their urinary tract, with their bladder. We see a lot of patients who have constant burning in the bladder area, or they have to go to the restroom a lot and not much is coming out, and all this. And this is very effective when we put this in the mix for these patients. Yeah.
Wonderful. I wanted to also mention here, one of my sons that you were so kind to help with, just for the audience, he had these type of symptoms that he tested negative for bladder infection, urinary tract infection.
But they are all testing negative for that. No.
Yeah, we thought maybe interstitial cystitis, but later on, we implored the use of electrodermal screening that actually discovered, which is a powerful tool that we've used here in the United States. I think you use something else called the time waver that's similar, frequency testing. But ironically, we found that my son, who really suffered with pans pandus, he had Borrelia in the urethra.
Yeah.
And he would never, I mean, I see patients struggling with this type of a symptom a lot. And I, suggest that they might use electrodermal screening or something like that to figure out what's going on. But I notice here this, let's see, 1, 2, 3, 4th paragraph at the end, it is not interstitial cystitis. As I mentioned a second ago, I didn't realize it was on this slide. I didn't get a chance to go over this one just yet, but how ironic. And these type of monitoring tools, I don't call it a test because it's not scientifically valid or proven, to be a testing agent, or a diagnostic tool, but it definitely is a very powerful monitoring tool that
Yeah.
found Borrelia inside his urethra. We were able to then eradicate it by focusing more on treating Borrelia, and the symptoms disappeared. And a lot of patients, kids with PANDAS especially, suffer from bedwetting. And some of that might be attributed to this type of an issue that can be helped by something like this. How do you say it? Angutzin?
Angutzin, yeah, Angutzin.
Okay.
I think that's someone you could get from an international pharmacy in Germany if you try to get it. Yeah.
It says it works as a broadband antibiotic on other bacterial caused cystitises and bacterial and viral infections of the respiratory tract.
Yeah. Yeah.
Whoop. Okay, here you go. Case 1.
We had a female Lyme patient, 49 years old when we treated her. Mostly Neurolyme symptoms like brain fog, depersonalization, sensitive to sound and light. We have a lot of patients who are very sensitive to sound and light. Strong digestive issues, was constipated all the time. Joint pain period was already over. That was a long time ago. Anxiety and depression was a big issue. We had a white blood cell count that was very low at 5.1. That is textbook in the patients we see. It's always around 4, maybe a little lower. We tested the blood-brain barrier protein S100, and that was showing that the blood-brain barrier is permeable. The atlas axis was dislocated, which is very often the reason for this blood-brain barrier issue. And she had also connective tissue problems because Lyme is eating up connective tissue. She had the Artemisia juice every day for 3 weeks instead of 2. Some people call it swamp juice, other people call it Grinch juice. Yeah, it's so we gave her ozone therapy, chemotherapy. So that's ozone giving in blood 3 times per week. She had in the course of the treatment 3 cat's claw IVs. We used neominophagen, which is an ingredient from licorice that is strongly antiviral. We did 3 times the heavy metal chelation. She had to stay a week longer here. And we did the autologous blood cell therapy back then at the beginning of the 4th week. Then she was on the maintenance program for 15 months after her visit here, mainly for fixing the microbiome. That always is a big part of the aftercare treatment, and it takes just a long time. Yeah. We were giving strong antioxidants the whole time. In the first 6 months, we used L-ornithine for ammonium in the body, which is produced by Lyme bacteria, but also by bad gut bacteria. And she's now able to work again, not full time, but she's doing her garden, what she really missed. She can now watch television and can attend big family dinners and even can go to concerts again. And that was not possible before that. She could end up in a seizure-like state when there was too much stimulus. Yeah. Yeah.
That's amazing. That's amazing. What a blessing for this patient. Yep. So basically, she has much improved her quality of life.
Yeah.
It says 90% after 15 plus years of Lyme Complex.
Personal assessment. Yeah, after 15 plus years of Lyme, I think you cannot go back to a state when you were 25, and that's not possible. So you have to look at the age. That patient was 49 years old. 15 years of Lyme. That means she started at the beginning of her 30s. So it's not realistic to have the goal to feel like 30 again at the age of 50. But I think it's you can feel like a normal 50 years old. That I think that's possible. Yeah.
That's amazing. Good job on helping that patient. Really, that's amazing. Okay.
Thank you.
Cool. Yeah,
then we have a very young male patient who was strongly affected by light and sound. So that was someone who came here with very dark shades and these earphones that block out sound. Serotonin was for an unknown reason very high. Adrenaline, noradrenaline were borderline low. Cortisol was also borderline low. Very bad fatigue. Gut was surprisingly not in a really bad shape. Atlas and Axis was already fixed. That was one of the patients where we recommended do it before you come. And heavy metals were also not detected, but that was mainly because of the young age, in my opinion. So he had also the daily Artemisia annua extract for 2 weeks, which is the normal time. And in addition, herbs, IV treatments for chronic EBV infection, which we identified as the main co-infection at that time. IV ozone twice per week, because that was what he tolerated. Usually we try it to do 3 times, was not possible here. Followed by 7.5 grams of vitamin C. Daily thymus gland injections, you for sure remember them as well.
Yeah.
Until we had 15, which is the maximum we give here. So Myers cocktails, amino acid infusions, green tea extract infusions, also to detox the brain. Daily discloses and Japanese knotweed for 3 weeks. And bicarbonate IVs for the lymphatic system, so that this guy was detoxing better. And the main issue with the young man was really to keep him detoxing. That's the big issue for a lot of Lyme patients. The genetics are usually not ideal for detoxing, and so we have to help as much as we can deliver and the kidneys to bring the stuff out of the body. That's so important. Yeah.
Okay, that's wonderful. Can you repeat what you said about cytochrome? That's a new word for me.
You basically have 2 detox phases in your body. The first one relies on cytochrome 450 enzymes, and unfortunately, this step makes a lot of already toxic substances even more toxic, but it's necessary so that they are water solutable, so that you can get rid of them over the kidneys, I mean.
Soluble?
So soluble. So you need this step. Unfortunately, it makes a lot of substances even more toxic. And in the Western people, we very often see that we have a very fast cytochrome 450 phase in the body. And unfortunately, we have a very slow second step in this detoxing. And that leads very often to the situation that these very toxic substances are circulating a long time in the body until your second step, that is connected to glutathione and some other enzymes, can detox them. So when you have a really fast CYP 450 phase and a very slow glutathione phase, that's the worst that can happen. And that's what we see in a lot of Lyme patients. So we have to give glutathione a lot, or cysteine, and support the second step of the detoxification for over a long time. We are using homeopathics, for example, to support the lymphatic system, the kidneys, and the liver. We are using a lot of S-acetylglutathione here in IVs, up to 3 grams. We are using the green tea extract to help detox the brain and amino acids also. So a lot of the treatment here, I would say at least a third every day, is about handling Herx reactions, helping the body detox, and yeah, keep the patients happy during the harsh treatments.
Yeah, it's not the easiest thing to do to treat Lyme and co-infections. So I encourage people to go experience what Michelle and I posted, and several other patients have put together forums on Facebook. But I speak of ours because we posted our treatments every day, pictures that go with it, the view, different things that we did inside the clinic, etc. So it's kind of nice to be able to see what an experience might be like at Villa mediGruen. So this example of case 2 is another example of a very much so improved quality of life, where this young man is able to feel better significantly after 9 months of treatment, and he was able to go back and finish his education at the university there.
Yeah, and 9 months is usually for such a young person, it's pretty long. When we treat younger people, I would say they are feeling significantly better after 6 months, but this was a very severe case. Okay,
and here you're going through some of the symptoms someone might experience if they're questioning if they have Lyme.
Yeah, this is more about the side effects of pharmaceuticals, because all the symptoms you can read here: headaches, hot flushes, stomach pain, feeling sick, irregular or fast heartbeat, dizzy, drowsy, back, leg or stomach pain, bluish fingernails, pale skin in general, difficulty breathing, fever, loss of appetite, unusual tiredness, weakness, itchy dryness, mood and mental changes, numbness, trouble sleeping. It does not have to be Lyme. That can also be a long-term side effect of antibiotics in most cases. So I'm not a big fan of taking antibiotics for ages, because after 6 years, I can say quite a number of patients came here where we cannot find any Lyme anymore, but we see all the damage that was done by Lyme, but also by the pharmaceuticals taken in the meantime for over a long time. And then stem cells have to repair that. Yeah.
Okay, that's important. Good.
Yeah.
Okay, I posted some request for questions from patients that I wanted to ask just a few questions. What are the ages of patients that you treat, Michael?
I think most of the patients are between the ages of 35 and 75. Yeah. And most of them are female.
Oh, wow. Yeah. Okay.
We also treat younger patients and also older patients. We do not treat children under the age of 15, but that's the average age. Yeah.
Well, that's wonderful that you see some younger kiddos, because there's so many people that need help. Their kids are really suffering, and you know, I'm a big fan to try and push you to eventually see children, because there's people are scared to treat them. It took me a couple of years to find people to treat my kiddos here in Texas, and we drove 4 hours one way to take our kiddos to the only person here that was doing a worthwhile job to treat kiddos. So we bounced around quite a bit in order to find the right doctor that was helpful, which brings me to how my kiddos and I got better. Can you talk a little bit about how you test your patients for ammonia in particular? That's a hard one, but Lyme and co-infection.
Ammonia, we have to send in serum frozen to a specialized lab. So it's very hard to test, and that the serum has to be there in time. So you have a couple of hours bring it there, but we can test it. Yeah, and in rare cases we also do it. Most of the time we give the L-ornithine to eliminate it in the body, and you should feel relief the same day when you take it. So when you are able to get some grams of the L-ornithine into your blood, then you should feel immediate relief, and that's also proof of ammonia issues.
Yeah, so it's a challenge, a natural challenge.
Mm-hmm. Yeah.
Okay, then how can patients best prepare to plan to treat with you at mediGrüen? What do you recommend people do before they come?
Yeah, just contact us, send us all the lab results you have. Oh, there was a part of the other question I didn't answer. So we do a lot of blood tests here.
Yeah.
We do urine tests for neurotransmitters, so we determine the serotonin, the adrenaline, noradrenaline. We, if not done already, we determine cortisol over the day. We are testing for histamine in the body and methylhistamine. So how's your histamine metabolism in the body? We are doing a heavy metal provocation test, so to see if there are heavy metals in the body that we have to chelate or to detox. And in the blood, we are testing with Armin labs for the co-infections and for Lyme. We also do an LTT with another lab in Germany for Borrelia. We are testing your Th1, Th2 immune response in the meantime, so that we can see is your immune system stuck on one side. It should always be balanced. We are testing every organ in the blood, so liver, pancreas. We are also doing a stool test, see if there is inflammation in the gut and how is the distribution of the gut bacteria. I calculated it a while ago, and we have over 300 things we measure here, and everything has influence on your treatment. So you come here and you have 1 or 2 days of standardized treatment, and then it starts to change. Then we adjust the treatment to the incoming lab results. Yeah.
Right. You recommended that I saw an Atlas Orthology chiropractor, and you mentioned a little bit about that in the interview with your slides. Can you speak to why it's important before people come to find a certified? That was a big difference of some of the people here in Texas that I called that marketed themselves as an Atlas Orthology chiropractor. They were not certified, but they had the equipment and had been trained, etc. There's actually only 2 here in Texas. And I drove all the way to Fort Worth to visit a few times, and then realized there was one 15 minutes from my house. So do your homework before you start plunging into something like that. But why would you recommend somebody go see an Atlas Orthology chiropractor first before they come?
It does not have to be an Atlas orthogonal chiropractor, but we recommend them because they the manipulation technique on the Atlas is done by a machine. So you are not relying on human talent here. So before we recommended these Atlas orthogonal chiropractors, we said just see someone who is specialized in the neck treatments, and some patients went there and had not a good experience. So we tried to find a place where the technique is something I can recommend from Germany without knowing the practitioner, because the machine is the same in every place. That's the main reason. When you have a neck guru living in your place, then go there. It's really important that Atlas axis is addressed, because when it's disaligned, you can have a chronic inflammation in that area. And when you have a chronic inflammation in the neck area, that can also lead to inflammation there. And inflammation in that area can destroy your blood-brain barrier. And then things can enter your brain that should not be there. Yeah.
As well as the treatments that you do not reach the brain.
Yeah, that's true. Some of the substances cannot reach the brain. Yeah.
So for the audience out there, an Atlas orthology chiropractor in particular uses the machine that Michael's talking about. If you can imagine this area, the atlas of the back of my neck looks exactly like this. Here's my shoulders, here's my spine, and one that I see has the machine that Michael's talking about that realigns that atlas, which is that middle spot right there, to where the blood-brain barrier is balanced in a healthy way. He does several different techniques of weighing you, for instance, on both feet. And a lot of times I take my kids there as well. A lot of times one will be much heavier than the other, sometimes 7-10 pounds. And through the ligamentous release type of adjustments, I don't like popping chiropractors. I use those for a long time, and they typically make Lyme patients feel worse because you're releasing a lot of the bacteria and Lyme from the joints when it's popped. And then you have to continue to go several times a week to help maintain that position. And I became hypermobile because you had to go so often. So through pregnancies, very painful situation because of the relaxin, etc. Not to diverge too much into something off topic, but the machine for an atlas orthology chiropractor is very important because it looks like a pull stick hitting a pull ball, and it's very structured.
Important to know that's not a one-time treatment, so you have to go there several times until it holds. Yeah. Until
it holds, and sometimes after stem cells as well. Is that right?
Yeah. It's not so important to go there before the stem cells. You can also go there afterwards. Yeah.
Which is what I did. Yeah. Okay. And then when does stem cells work best for patients to repair?
I think when the program, when you have a program in place that reduces all the toxic burdens, the bacterial burdens in the body, so that your body has time to breathe, to reinvent itself, so that's it's not constantly in fight. So when you can take away a lot of the bacteria and the toxins and all this, then your body's in the right position to use the stem cells. You should not give them without a preparation program. So I think that's what happened in the patients where it didn't help. So they went to a place that is specialized in joint treatment or something like that, and they get also a high number of stem cells, which is not always right, and then were sent home without a program in place. It's a waste of money and can even make you worse. Yeah.
Interesting. Yeah. So when I was a patient with you, a lot of times you'll have, like myself and others that I've helped come see you, do a program before they come for several months to prepare the body. And then I think my treatment, I said it earlier, was 3 weeks. I think I came for 2 weeks actually, because I wasn't in really bad shape. I had treated 5 years for the audience out there. So as Michael's mentioning here, I addressed a lot of the burden of my pathogens before I came, and I felt like I was in a good position to repair the damage that infections had caused. Which brings me to my last question. So what would the individualized treatment plan consist of before, during, and after? I know that's a lot, mouthful to mention for you to answer, but what would the common Lyme patient look like? Every treatment I know is customized and individualized. It's hard to price one, 2-week treatment, for instance. It's always individualized. What would you recommend for patients?
When they come here, when we start treatment, so there are some things we try to do. So it's 2 to 3 times ozone therapy per week. That's what we do. You can say it's between 5 and 11 different treatments every day. So it's a pretty intense treatment while you are here. The green juice for almost every patient, except when you have a reaction to it. We are using it, so you have to drink it every day over the day. In the morning, you get your special mix of the other herbs in some water that you drink while you are here. And you get some other pills now, sometimes a little bit of iron when you are deficient. Selenium sometimes we give now. We give PQQ and fucoidan every morning. And I think these are the things that almost every patient has every day. But then we will give you a Myers cocktails. We give you high doses of vitamin C. The thymus treatment is also something that most patients get.
Yeah.
In case of very strong autoimmunity Lyme symptoms, we use a little different thymus extract. The gut treatment is most of the time we start that after you leave here, because the result from our gut test takes a while, and it's also taking a lot of pills, and we don't want to overburden the patient. So this is also something, because it takes so long, you can also start it at home. It will take 3 months anyway, minimum, to fix that. So it does not, there is no real reason to start it here. We are using a lot of amino acids, the L-ornithine for the ammonia in the body, lysine as a powerful amino acid against Epstein-Barr and other viruses, for example, arginine as well, together with lysine, because then it works antiviral also. It's also an oxidative stress scavenger, so it brings that down. The EGCG, the green tea extract in IVs we use for detoxing the brain, because then your body can dump toxins out of the brain. What was the question? Sorry.
No, you are you're well into a great answer of the question.
Okay.
What would the individualized treatment look like for patients? So that's a pretty extensive, detailed treatment plan that might be more common than not. So the IVs and the treatments there every day, for a patient that's out there, you might, let's see, sorry, this is, that was canceled, by the way. So 8 hours a day typically is what patients might be there for.
Pardon?
How long would a patient be at your facility?
Oh, in 80% of the cases, it's 3 weeks now. Yeah. We have this 2 weeks of cleansing, and then at the end of the second week or the beginning of the third week, we will send you to the stem cell laboratory we choose. Yeah, that also depends on the lab test. So it rarely happens that we have the blood stem cells in mind when you come here, but then we recommend maybe fat stem cells or something like that. That can change. Yeah.
Okay, and the day might look as long as 8 hours a day to do 5 to 11 IVs a day and the different treatments you do?
So sometimes, yes, you start between 9 and 10 in the morning, and yeah, it can go until 4 or 5 p.m. That's the longest. Usually you can leave the practice at about between 2 and 3:30. Yeah.
And can you mention a few of the different treatments that you use alongside of some of the things that you mentioned today? You talked a lot about IVs and herbs. What are some of the other things like biomat, yoga, etc.? Yeah,
we are using a Bema mat. That's also something we try to use 2 or 3 times per week. We have now a high tone therapy device. I think that was not here when you were here. That's for mitochondria rebuild in the body. Yeah, we have a cupping machine that we rarely use, but sometimes we, what else? The ozone and the colon hydrotherapy.
I was going to colonoscopy. Yeah, not colon. colon hydrotherapy.
For
That's
hydrotherapy, we are still using. We now determine your heart rate variability. You know that, to see how your vagus nerve is reacting. So are we able to affect the vagus nerve with our treatments? And if not, then we can give you some exercises for it. Hannah is doing that, so you will have yoga here, of course. Andrea, our craniosacral osteopath, is still coming, and
wonderful. Yeah.
Liane is here for the massages still. So these are also parts of the treatment, and it's not wellness or something like that. That's definitely part of the treatment and important to have.
Yeah, and for the audience out there, Hannah is his lovely wife, and she's a yoga instructor, so her and I got along really well. I'm a yoga instructor as well. The cranial sacral was really powerful. Some of these other treatments that you provide therapy for patients is really powerful to accompany some of the other stuff to help relieve the patient of discomfort and Herxheimer. What's the common, I know it would be hard to say it's going to cost everybody $25,000 to come for 2 weeks, but what would you say is a range for an individual who's been sick for a long time with Lyme co-infections? And maybe a range might be helpful for someone else considering this type of
it's mostly determined by the stem cells we are choosing, but it's between 19 and 25,000 euros indeed for 3 weeks of treatment.
3 weeks. Okay. Wonderful. Well, thank you so much, Michael. This has been very helpful for patients out there considering stem cell treatment. There's been so many people that have come and gone offering stem cells, and it's been more wide known here in the US for prolotherapy and joint therapy, where people are trying to avoid having knee replacements and things like that. But what you do is trying to repair the immune system and damage caused by the infections that a patient like me who had it 32 years before I was diagnosed. I saw a lot of 16 different specialists that missed it. So for a patient like me, I'm probably a more typical patient for your clinic, wouldn't you say?
Yeah, most patients we see have seen a lot of doctors before and had a lot of treatments before. Yeah.
That didn't work.
Yeah, that didn't work. Yeah, otherwise you would not travel to Germany.
Yeah. It's lovely talking to you again, and thank you so much for your time. And
thank you for having me and helping me out.
Yeah, absolutely. Happy to do it. And I will be happy to do the other series that you have in mind to put out for patients. We can get your okay. Well, any last so can you mention, I know that was on your first slide or second slide, can you mention your web address for people to contact you again to reach out and ask questions about your facility?
Yeah, it's www.villa-medigrüen with ue.de. So
yeah, so it's ILLA-MEDIGRUEN.de.
Yeah, yeah, you're right. I was wrong.
Correct?
mediGrüen. uen.de. Yeah.
We got it. Hey.
You got it.
There's always a language barrier between us, but we always end up getting it right at the end of the day. Okay, Michael, thanks so much. I know it's later there, so we'll let you go. Really appreciate all the information. Your service was really helpful for me, helping me get back to my life and back helping my kids and being a functional member of society. And I think the really powerful part of what you do is that you focus on chronic Lyme patients to improve their quality of life. And that's really what I'm after, in helping to get this information out there to a much needed community, to where there's no patient left behind is my hashtag I keep posting everything about, because this patient community has been left behind by the majority of traditional allopathic medicine. You were great also, just to lastly mention, in being able to get my veins when a lot of people weren't able to. You guys have some great pokers there. So
Yeah, that's true.
yeah. So you
Yeah,
guys,
Christina, thank you for all you do, also for the community. Yeah.
well, I have 4 congenital Lyme kids too. So I say that I'm filling my karma cup because someday my kiddos may need help. And I want it to be on every street corner. If somebody has struggling to get help with Lyme disease, they shouldn't have to go to the ends of the earth to find it and, struggle. So I want to try and help people save time, money, and heartache. That's my goal. So we'll talk again soon. Everybody out there,
We will.
like this video and subscribe to my YouTube channel. We also will be hosting this on all major podcast channels. And if anyone has any questions, reach out to Michael or myself. We'll be happy to help y'all. So have a great day and always keep up the faith and have hope you too can get better. Thanks, Michael.
Okay. Yeah. Bye-bye.
Bye.
Bye.